Dr.
Hey,
Gary.
what's going on, Dr. Alex?
It is going great. Enjoying my quarantine Sunday.
Thanks so much for joining me. We already have some viewers, which is great. So, for those of you, those I guess of my friends and followers who don't know Dr. Alex, so he's a really good friend of mine, a phenomenal dentist, does some routine dentistry, but a special focus on cosmetic dentistry here in New York City in the West Village. And I'm so thankful that you're able to join me today.
Always a pleasure. I really cherish our friendship and being able to bounce all these ideas off of each other. It's amazing how much you can learn from different people from different disciplines. So it's always a good
And we've
time when we
had a
chat.
number of patients, mutual patients over the last, I guess, 2 years. And it's really been interesting, seeing how, someone comes in for one issue and they don't always realize that they need multiple specialists to accomplish their goals.
Exactly. I mean, this is why we do our networking dinners. We talk with other doctors so that we can kind of pick things up and be able to knowledgeably refer people to our colleagues to know what's going on besides our own field of expertise. Super
Yeah,
important.
yeah, for sure. All right, let's jump into it. So, what makes for a beautiful smile?
Beautiful smile. I think a better question is what makes a kissable smile? And I think that's just a little bit of confidence and fresh breath, if you ask me. But really good question. A beautiful smile. It is subjective, but I think when people think of a beautiful smile, they think of clean, white, and straight teeth. That pretty much is what people define it as. But there are nuances that go into it, like the harmony, the way the teeth follow the lips. Different teeth have different proportions. But I think in general, it's a smile that fits the patient's face. So you're an expert in facial aesthetics, facial symmetry, and I think that the teeth just follow that. You can't have teeth that were perhaps you got a smile makeover and they were just stock printed. Everyone gets the same teeth, but they totally don't fit the face at all. So a beautiful smile is something that kind of exudes confidence and your own personality.
Got it. No, great answer. So, is it okay for someone or almost preferred at times for someone to have some degree of asymmetry when it comes to their teeth? Because in the face, our literature shows that if you have someone with a perfectly symmetric face, that they actually are perceived as being less attractive than someone with some degree of asymmetry. Obviously, you can't be totally asymmetric or else that starts to look a little off. But some degree of asymmetry is preferred to complete symmetry. So is it like that with the teeth, or would you say that it's better to have them be really totally symmetric and
That's a
perfect?
good question. When we learn to do smile makeovers, and again, I'm very fortunate because I was in a very special program at NYU with the guy that invented veneers, and we had a whole curriculum around aesthetic dentistry. But exactly what you're talking about, facial symmetry, we studied that. So we would actually, for all the cases that we presented in the program,
Mhm.
we would have a certain template that we used, and we would take the person's face, we would take the left side of the face, and copy it, flip it, and put that together as one side. So it would be a perfect symmetry on the other side. And yeah, people looked ridiculous being 100% symmetrical. So when you're building the smile, you also look at the face and the symmetries, and sometimes you even shift the teeth a little bit to compensate, but for the asymmetries in the face.
Yeah. No, that's interesting because I've never read about that or heard about that. We've never discussed that when it comes to dentistry. Yeah, I mean, I find that in almost every single patient of mine, every person, walking this earth has this almost like a bony asymmetry, really, and then the soft tissue really follows suit. So it's the bony structure that's a little bit off from one side to the other. Usually one side's kind of stronger and larger than the other, and then everything else sort of follows that underlying skeleton. So yeah, so that's interesting. So for example, in also talking about the smile, some people say, well, not so much just in a static way, but when they're smiling in a dynamic kind of motion, they find that one side is just kind of higher up, it pulls a little bit more, maybe more of a line forms and nasolabial fold on one side versus the other. And then they're like, well, how do I make that symmetric? Why is that the issue? Well, the muscles on one side are probably stronger than the other, and there's really no great way to make the muscles completely the same because one's just going to be a little bit bulkier. So that's kind of what so just more education than giving them a great treatment, sometimes. So,
Well, it's interesting you're talking about the nasolabial folds, and the question is why Is there more pull to one side? Is it muscular? What is that area of the face sitting on? It's sitting on teeth. So if you have a big asymmetry in your teeth where
Mhm.
one side is sunken in and the other side is bulky, maybe some teeth are crooked and sticking out, that's going to create asymmetry of the soft tissue that's on top of it. So that's something that can also potentially be corrected through orthodontics, through dentistry, through
Right.
veneers.
Right. Makes sense. All right. So for the teeth, so I do a lot of these lip lift surgeries, and sometimes I find that people's teeth are just kind of really short, and I'm always tempted to send them to you to just get them lengthened, or the other way around. And I know we've touched on this in the past, but you can sort of tell the audience what your thoughts are on kind of changing the height of teeth. Is that doable? When is it doable? What are the pros and cons of doing that?
Yeah, so can we make teeth bigger or smaller? The answer is yes, within reason. So making teeth larger is usually a lot easier because it's additive. You're just layering the porcelain on top of teeth. You're minimally having a surgical intervention is just additive. And taking away has its limits because there's a layer of enamel, there's a layer of dentin. There's just so much you can take away for it to
Mhm.
still look good and for it to still be healthy. But yes, you can change them bigger, smaller, wider, thinner. That's all possible.
Very cool. Difference between veneers and implants. Because I have a decent understanding of this topic, but I think unless you're in this kind of aesthetic world, it's hard to understand always like the different terms. And I know to you that it's probably so obvious, but to many people, it's kind of confusing. Sometimes terms are used interchangeably. So if you can just explain the difference between those two and maybe what other words are being used out there on the web or in people's offices to describe those procedures.
Sure. So dental implants and veneers are two totally different things that have a different purpose and different approach. Dental implant is basically like the foundation of a house. So you need something that goes into the ground to anchor everything. That's your foundation. In the mouth, you put a titanium screw basically that is a replacement for a root, and you put that into the bone, and that's a surgical intervention. It's a pretty simple surgery that takes less than an hour and usually doesn't hurt at all afterwards. That's basically the foundation of the house. The whole house I would describe as the crown of the tooth. So that's the visible part of the tooth that you see when you're just showing your teeth, like teeth. That's the
Yeah.
house. Veneers are kind of like the facade that would be at the front of the house. Like you have a house and you add all this beautiful brick or whatever you want to the front of it so it looks better. Those would be veneers. You're only covering the front. So it's basically a full replacement, a foundation in a house versus just the front.
And so
That's the
some
difference.
people need both and others can just get away with veneers. Is that
Yeah,
accurate?
basically, if you're missing a tooth, a implant might be the best solution to replace it. You could use a dental bridge, which just connects two teeth and the missing part,
Mhm.
or a full implant, which is a surgical procedure.
Got it. So just to touch on some questions that we've received already, is there something that can be done that's between veneers and bonding?
Between them, no. This
So let's
it's
let's define bonding.
Yeah. So bonding is basically layering white filling material over your teeth. It's done in a beautiful way. It's done with many layers, and it's done to create a different color, a different shape. It's not just to fix a cavity. You can basically do a smile makeover using white filling material. Now,
Instead of
the
veneers.
instead of veneers. Now, the cons of that is it's really a lot more technique sensitive.
Mhm.
It doesn't last as long, and in most people's hands, like 99% of people, it's not going to look as good.
Huh.
So veneers are the more predictable, the more beautiful, the more long-lasting way to achieve a smile makeover.
And how long would you say veneers last? Can they last the whole lifetime, or would you expect to, I don't know, modify them over like a 10-year
Yeah,
span?
they can last the whole lifetime if you don't plan to live too long. Unfortunately, they last for 10 to 20 years, but we've seen them last 30 years. There's a few factors involved, the type of material. So you want to make sure that your
Mhm.
dentist is using the highest quality porcelain laboratory materials, bonding materials. Everything is of proper caliber. And also the technique that the dentist uses is tried and proven, and they've done a lot of cases, so they really know what they're doing. The other factor that's involved with making it last long is that the patient takes great care of it. You have to take care of veneers much like you would take care of your natural teeth. You got to brush, you got to floss, you got to make sure that you're not getting cavities in the
Right.
back of your teeth. Yeah, great
And
question.
the material of veneers, is it always porcelain or is it
Always. Yes.
always?
Yes.
And what exactly is porcelain?
Porcelain, it's ceramic. It's basically
Mhm.
little glass particles.
Ah,
So the way it's made in the laboratory is they have a variety of different color powders that they take a brush and they
mhm.
basically dip it in the powder and they build up the tooth. And when it's all built up, they put it in an oven, they bake it, and it comes out super hard and
Oh,
really strong.
right. And I know that you're always talking about these kind of models that you've made of people's teeth and how they're going to look before you actually make the final veneers. Is that correct?
Yeah, so whenever we do a smile makeover somebody, we start with the end in mind. So after we do the whole facial analysis and have a really thorough discussion on what the patient's expectations are, we
Mhm.
need to be able to communicate what the patient wants, what we know is possible, and also the third part of the team is our laboratory, our ceramist. So using photos and descriptions and models, we communicate everything with the ceramist, and
Mhm.
what they give us back is called a wax up. So it's basically a mock up of what the final product is going to look like. So we can actually show the before and the after to the patient, but then we can take it a step further and try it on in their mouth so that what they expect is what they're going to get.
So these ceramists, they're like artists who are making this in the lab?
Absolutely.
Wow,
They're artists at the highest caliber because they
that's
have to
very
really
cool.
visualize this
Yeah.
and deliver it from their mind to their hand to the patient's mouth on a very micro level. They're working in
Right,
microns.
right. Very interesting. How much does the Hollywood smile cost? Somebody asked. At least the range of the cost. So
How
whether
much
it's
does it
Hollywood
cost?
or New York City, but yeah, essentially just the cost of a smile makeover, approximate ranges.
Yeah, I mean, we can accomplish a smile makeover for someone with something as simple as a whitening, could be done with just maybe 2, 4 veneers. So I would say
Right.
from a few $100s a month on a payment plan to all the way to tens of thousands of dollars. So it can get pretty pricey, but it can be really worth it.
Yeah, for sure. Which would you recommend doing first, the lip lift or dental work? I mean, I'll give people my opinion, but I want to hear yours.
Well, that's a good question. Why do people get lip lifts?
Well, oftentimes it's to expose the upper teeth. Not always. Some people just have a really thin upper lip and they want a more red lip show and they're bothered by their elongated philtrum. So I would say maybe 60 to 70% of the time it's because they want their upper teeth exposed. In which case, I would imagine you don't want to expose bad teeth, but it's not the primary reason for, the remainder of those patients that come in.
Well, okay. So if their only reason to do a lip lift is to expose more teeth,
Hmm.
and they're planning to get veneers anyway, would they be able to show more teeth by just making their teeth bigger with veneers and then not need a lip lift, right?
Sometimes, yeah, it's
Yeah,
possible.
so that's possible. And for that, I would say that a collaboration with a cosmetic dentist and a plastic surgeon
Yeah.
like you and I, we can actually do a mock-up in the patient's mouth before they have their lip lift to see if they're
Hmm.
satisfied with those results. If not, I would say to do the lip lift first because once that's in a healed, predictable position, and like you said, lips become even thicker after this. This is one of the reasons that you're doing it.
Yeah.
We want to see where that's stable so that we can create veneers to match that new whole context of what's going on.
Right. Yeah, and sometimes patients will come and they'll have other types of like more, I guess, complicated orthodontic type surgery that's being planned. And my preference, honestly, is always to just have them deal with all the bony skeleton structures first, get that set properly, and then I'll work on the soft tissue. So my preference is to have all that done first. But it's just that, a lot of people, even if they recognize that they would love to have veneers done or, go through that process, they maybe can't afford it at that time when they come see me or, or other reasons why they just really want to just get the lip lift done because they're always just so focused on that part of their face. But if it were up to me, I would send them all to you first and then deal with the rest. I just feel like you said, like if you have, some missing teeth or you just, something is off about the teeth, it's going to change the way everything else looks on the surface. So I'd rather have that set right, and then deal with the skin.
Yeah, and I think that we should approach cases like that together, not first or second, but
Mm,
really look at them at the same time, whether we're there in person, our offices are not too
yeah,
far from each other, we're in the same city, or communicating through pictures and videos.
yeah.
It's definitely something that should be planned before drill or scalpel is picked up.
Yeah, yeah, no, I think that's a great idea. It's there's always room for improving efficiency, not just within one practice, but across practices. So for sure. Someone asked, let's see, my friend thinks she has a what is it, receding gum line. She's nervous about lasting through the pandemic without her teeth becoming lost. Is that what it said? Lost? How long can this go on for? The receding gum line? Okay. So is there a point where it recedes so much, I guess, that the teeth get affected?
Yeah, it can. I mean, unfortunately, we're living in a crazy world right now, especially being in New York City. Dentists have basically been deemed non-essential, except for emergency treatment where there's sharp pain or swelling. So there's limited dental care for sure. Most dentists that I know, or I would say all dentists that I know in New York City are closed right now,
Right.
and people are going to hospitals or to a few select
Wow.
specialists for treatment. Now, specifically with gum recession, that's something that doesn't happen too quickly. That takes
Mm,
months and sometimes years to develop.
yeah.
So that would be on the lower priority of things to deal with. And once the pandemic's over and we can go back to work, a lot of times gum recession can be treated with a graft. So as long as there's no extreme pain right now, swelling, then that would be something that can wait.
Got it. And then Invisalign. So just educate us on Invisalign and how does that work in with the smile makeover for people?
Basically, when your teeth are in the right position, whether they started out that way or they were moved that way through orthodontics, through
Mhm.
Invisalign, when they're in the right position and you're putting veneers over them, you don't have to cut as much. It becomes very minimally invasive. If you picture a tooth that you're not going to do any ortho on and you're going to cut for a veneer and it's sticking out of your mouth like this, you have to cut it back a lot to put it into the right position and then put a veneer on it. If it's in the right position first, then so much easier. So I always encourage my patients to straighten their teeth first when it's called for, and for when it's not, then we can go straight to veneers.
So do you think of Smile Makeover as like kind of a spectrum of, I guess, very minimally invasive in the form of like whitening the teeth to like maximal, like doing the Invisalign, whitening, and then veneers of the whole mouth? I mean, is that kind of how you think of it, or do you have some other paradigm?
Yeah, yeah. So it's not like just one definition. What is a smile makeover? Answer veneers. That's not what it is. It's basically looking at the full entire structure, looking at the patient's goals first and foremost.
Mm,
For somebody, it might just be they want brighter teeth, and honestly, it might just take a really thorough cleaning. You'd be surprised how many patients we do a cleaning for, and their teeth are so much brighter because it's been a while.
yeah,
So that would be the easiest thing. And the second easiest thing, which you're probably thinking about first, the whitening, you can't whiten dirty teeth. So you get the teeth nice and clean, you whiten them, and that's kind of the entry point into smile makeovers. And
right,
it goes as much as doing every single tooth, like really altering the jaw position, altering the bite, altering the complete color, shape, size, everything. And it does get complex, but it doesn't have to be complicated. A lot of these procedures can still be done within a couple of weeks, a couple of months.
yeah. Someone asked about Smile Direct Club. I've asked you that before. I remember you weren't very fond of them. What are those types of services, and why aren't they great?
Yeah, so Smile Direct Club is basically a direct to consumer aligner company. And the reason I don't care for it is because I'm seeing a lot of complaints from my
Mhm.
patients, from people I know, and in the dental forums of Smile Direct Club aligners, and same thing with other direct aligner companies like Candid, is patients aren't getting the customer service and the treatment that they would otherwise get from a dentist. Basically, you're taking impressions on your own at home or even in their store by a tech that has not as much training as a dentist, of course. So, I'm seeing lawsuits coming out left and right.
Yeah.
Before, what these companies did was they made patients sign contracts that they wouldn't leave bad reviews, or they would sue patients for bad reviews, and they would sue dentists for speaking up about these companies. But now we're seeing class action lawsuits against these companies. So, unfortunate thing is the people that invested in them will probably cash out before it gets too bad, and there'll be a lot of victims in terms of patients that didn't get proper treatment.
Yeah, I mean, it reminds me of some of these hair restoration companies like Hims and Keeps, where you basically, you just talk to someone over the phone and they send you a prescription for, finasteride or minoxidil. I think it rarely really treats, the not just the underlying issue, but it doesn't really give you the full range of options that are available for hair restoration. It's unfortunate, and I think they're doing a disservice in that. And maybe it's not as damaging as like you said, like where they're sending you the actual, I guess, aligners or straighteners that could mess your teeth up even more. But there's also the idea of just like not offering everything that's available to someone for their
Yeah,
teeth or for
I
their
mean,
hair.
listen, there's a time and place for telemedicine, and we're seeing it kind of shine right now during the pandemic, where people can reach out to doctors and providers and have their questions answered. So it can be a good thing, but call me old-fashioned, but I think there needs to be a relationship between a patient and their doctor,
Yeah,
somebody that's following up with them, somebody that knows the broader scope of their medical or dental history, that can
yeah.
just follow up and be there for them. And a lot of these companies are not about that. They're really just about profit.
Yeah, I think whether you're right, whether it's like a remote company or a local provider that's just pushing one treatment, because they have the most to benefit from it, or that's all they know how to do, I think therein lies, the main problem. I think being able to offer someone a comprehensive array of options is really the key, especially, for people who, want to seek out a true specialist in an area. I think that's what separates someone like you and I versus, other people who maybe just dabble in something, and that's the difference. So someone asked, what can be done to clean whiten a veneer that's
Yeah,
gone
that may
dull?
have gotten dull over time through coffee or wine. All right, so this is a very good question, and I have a couple of things I can tell you about that. Natural teeth get discolored. Natural teeth are porous. So if you drink coffee, wine, your teeth are actually going to absorb the pigment, and they're actually going
Mhm.
to, I guess, get less white. And you can just clean them, but you would actually have to bleach them so that the bleach penetrates the teeth and they get really white. With ceramics or porcelain veneers, they don't um, they're not porous, so the
Mhm.
stains are superficial, so you can just basically get a professional cleaning and it'll scrub right off. That's as far as stain is concerned. The dullness is a whole different factor, and I'll tell you something about dullness. A lot of the prophy paste, the basically what dentists use in the office professionally, it's very rough, it's very abrasive. It's
Mhm.
perfect for teeth, but over years and years of using that to clean veneers, it's going to get dull. It could potentially remove all the luster and all the glaze that was originally put onto the veneer. So in our office and many dentists across the world, we use a special different prophy paste for ceramics, and that way they don't get dull. But like we said earlier, 10, 15, 20 plus years, and you're going to want a new set.
So related question to that just kind of came to mind. What about injury to a veneer? Like if, you fell on something, you bit something too hard and it chipped. Is that something that you can repair right in the office, or do you have to kind of send that tooth out, or what do you do with that?
I told you in the beginning that the process to make a veneer, it's layering powder and then putting into an oven. You can't put the whole patient into an oven. So if
Why
a
not?
veneer, if a veneer chipped, you would
Mm,
basically prepare the tooth, take an impression, send it out to the laboratory, and they would make a new veneer that you would glue on. But keep in mind that veneers are very strong. So something that could crack your own tooth would potentially crack a veneer as well. So you want to be
mhm.
careful. You don't want to use your teeth as tools, like opening bottles, biting your nails. Just don't use your teeth as tools, and they'll last a lot longer.
Right, right, right. Makes sense. Someone, let's see, asked about recommendations for over-the-counter whitening kits. Oh, did those help or hurt?
Yeah, so their question is that won't hurt your teeth. Any whitening, whether it's at-home whitening or professional whitening, can cause tooth sensitivity, and that depends on the strength of the whitening agent. It also depends on the patient, on the anatomy of their teeth, on how sensitive they are. And it could be like one sensitive tooth, or it could be all their teeth are sensitive. When we use professional whitening agents at the office, we actually use desensitizers to help lessen that pain. I don't really like to promote at-home whitening products. I'll give you, some warning, like if it's like and a funny glowing package, it's probably like a gimmick. Whitening products are pretty simple. It's hydrogen peroxide or carbamide peroxide with different strengths. I've seen a lot of patients try Crest white strips. It works for some. For others, it causes a lot of sensitivity, but it's pretty inexpensive to at least try and see if it'll work for you.
Okay. All right. Thanks for that. Question about lip filler. One of the issues I have with lip filler is that I've noticed that it really does tend to kind of cover the upper teeth some in most types of injections. I mean, it's hard to inject the upper lip in a way where you don't cause it to kind of fall down over the teeth. Have you seen that? Do you have any issues with that, or do you think
I mean, listen,
it never ever
I
happens?
do lip filler a lot less than you do lip filler. So, if I have a difficult lip filler case, I send it to you. Do I see it that some patients ask to make their lips so big that it covers their teeth, or it even covers veneers so perfectly placed before? Yeah, we see that. So is the patient gonna then get smaller lips, or do they love that look? And do we have to now make bigger veneers? It's a case by case basis. The aesthetic that I personally prefer is natural aesthetic. That idea of a Hollywood smile from back in the day where it's like picket fence, chiclet white teeth. I'm not really into that. I like teeth to look like they belong to the person, like it's their natural teeth, but clean and white and straight.
Right. Makes sense. All right.
I've sent you patients, and I know that you have a very similar aesthetic as well.
Yeah.
We're always kind of trying to balance what we know is going to look good and what's going to look natural with some patients' expectations that might not be realistic.
Yeah.
And there's a limit to how much I can give and still feel good about doing that type of work. So,
Yeah, yeah, no, for sure. That's a good answer. I spent some time today on the Real Self website answering questions related to lips. And what I was finding is that it was just amazing how many of those questions really related to teeth. People were saying, well, I want, better smile so that, my teeth are more visible. I kept including this in my answer more so than I did before, which was, like in addition to just thinking about a lip lift or a lip augmentation, like you need to go see a cosmetic dentist to talk about your options. I just think it's such an important whole entire area that just frequently doesn't get thought of when people are so fixated on their teeth on their lips.
yeah, I mean, it's all about collaboration. You've been to school for so many years, right? You know so much stuff about this thing that you do, and I've been to school for so many years, and yet I don't know anything that you know, and you don't know what
Right,
I know. It's all about
right.
working together. If you can be in school for 200 years to be like the perfect ultimate doctor of everything, that would be a lot of fun, but we don't have that time.
Or maybe one day it'll just be like the Matrix where you just download the knowledge.
Maybe be fun.
Let's see, anything else? Any other questions come in? Okay, I have my scribe sitting over there, aka wifey. All right, anything else about, cosmetic dentistry that you wanted to touch on, or have we covered most of it in 30 minutes?
I can talk about cosmetic dentistry honestly
Well,
for
I know
hours and
there's a
hours
lot
and
of like
answer all your
technicalities.
questions. There are. It's something I love. It's this combination of being a doctor, a healer, a psychologist, and an artist. It's so much of understanding what the person wants and interpreting it and being able to deliver it to their expectations. It's something that's not really as scary as some people might think that it is.
Well, people
Um,
are scared of the dentist. I mean, that's just, I
But what
think
does that mean? What are they actually scared of? They're not scared of me, right? Like
they're not scared
I,
of
I'm
you.
nice to them. They're scared that something might hurt. They're
Right.
scared that they're gonna go into a dental appointment, not having been there for a while, and somebody's gonna tell them that they have a lot of problems that they didn't know about, that they wish they didn't
Right.
even find out about, and that it's gonna be very expensive. So at the office, we try to basically be like the fun office where forget the fact that we know what we're doing. Like we want people to feel super comfortable. And that means that we do things in a way that's not going to cause pain. And we have payment plans out to like 5 years for people so that a smile makeover that's tens of thousands of dollars translates into just hundreds of dollars per month and is
Right.
manageable. Because when you think of like, I have people ask me, what is your ideal patient? What do they look like? How old they are? Like, what kind of work do they do? I've had patients that gotten smile makeovers for me that are super young and they didn't have these super excellent jobs, but they wanted to have that confidence and that look right away. So we helped them finance their smile makeovers. And we've had patients in their 50s, 60s, 70s, and beyond that had the money to do it right away. It was something else triggered them to finally want to get their teeth done. Like maybe their grandkid said, like, "Hey, Grandpa, why are your teeth so yellow?" It's all kinds. So I don't have like a demographic ideal patient. It's
Yeah.
just somebody that wants to feel beautiful, wants to feel confident, and
Right.
we make that happen for them.
I think the other thing that scares people when they, and I can speak from partially from experience, but also just thinking about what scares people about, things that I do. I think sounds can contribute. And I know that in dental offices and for dental procedures, oftentimes the drill can be, a bit loud and unnerving. So I don't know, for veneers, is it the same like loudness of the drill or is it different? Or are there
Good
drills that are
question. I mean,
quieter these days?
sounds are important. So you've been a patient of my practice, and you know that one thing we always do is we let the patients that are in the chair pick their favorite songs to play, their favorite playlist. We have an Alexa there, and we have fun
Good.
conversations, and we drown out those little bits of necessary sound that comes with being a dentist.
I always have a great time in your office. Mostly the sound of your voice is what I like the most.
I try to
It's
speak
calming.
slowly and hypnotically.
That's right. Someone asked, would bonding be done to help with translucent teeth?
It can be. It can be within reason. Usually, the biting surfaces of front teeth are the parts that would become translucent first, and it's possible to do some bonding. And I always prefer when it's possible, when it's reasonable to do veneers because they last longer and they look more beautiful.
Right. And how do people, we have a question about Julia Roberts and why her smile is so famous.
It's Julia Roberts. She's just famous. She has this like really wide smile. It's very
Yeah,
toothy. She
it's
shows
wide.
so many teeth, and she does it elegantly and beautifully.
Yeah, for sure. And then how do people reach out to you, to your team to make an appointment?
Yeah, so right now during the pandemic, we are on skeleton crew where I'm answering a lot of the questions if patients call in with an emergency directly with my emergency number. But I think everybody watching this can contact me on Instagram. I'm on here a lot. They get to see my profile with some examples of my photos while they're over there, just at Alex Shalman. And reach out to me, DM me, I answer.
Yeah, no, it's great. Thank you so much for doing this. This was great. Anything else you want to add?
I mean, it's always great chatting with you.
Yeah,
Thanks for giving me an opportunity to connect with some of your patients, some of the people that are following you interested in
absolutely.
aesthetics. In a perfect world, maybe you and I would not even have a job because I believe that beauty does come from inside and so does
Yeah,
confidence. But it's not a perfect world. And the way we look is the way people perceive us. And if we don't have the right teeth and the right smile, people might assume certain things about us that are not true. Like we don't care about the way we look, we don't take care of ourselves, we don't have any money. And it is important to look presentable in the world that we live in. So I think that we're doing our part, as small as it is, in helping people to achieve that. And I do it with love.
yeah, no, that's very well said. We received a question about the exact location of your office.
Yeah, so I'm in the heart of New York City, in the West Village on West 10th Street between 5th and 6th Avenue. It's all directly on my profile. It's a beautiful little practice with murals right on the wall, with art everywhere. So it really feels like an art studio more than medical office or dental office. It doesn't look sterile. It just looks like you rolled up into my living room and you're hanging out, and then you get brought into this nice clean operatory where the magic happens.
Well, this was great. Again, thank you so much, Dr. Alex. And I think we covered some really good ground. And I look forward to continuing the collaboration, for our amazing patients. And like you said, we could always find ways of improving, I guess, the degree of collaboration and making it a more seamless process for patients to, really be able to get the proper care. It's really at the end of the day about that, and not doing what some practices do, which is to kind of hoard patients and to offer them as many services as they can without opening it up to everything that's out there that exists that maybe
Yeah, I mean, it's
isn't
the
that
abundance
service.
mentality. When you choose collaboration over competition, everybody wins.
Right. Yeah,
That's what it comes down to.
that's exactly right. Well, great. So we'll chat again very soon. And
All
thanks
right, my
so much
friend.
again for joining me.
It's been a pleasure. Thank you.
See you. Take care. Bye.